The Challenging Behaviour Foundation supported family carer experts by experience, who also wrote a report that was published alongside the Care Quality Commission report about the Learning Disability Review. They identified a number of issues. These included service delivery. So for the service delivery, they found no consistency in the type of service delivered. There was no such thing as a typical assessment and treatment unit. They found that despite the high cost, there was often a lack of specialism. There were poor environmental factors, and these ranged from the size or design or standard of accommodation, the on-site facilities, and the mix of residents. They were concerned about inadequate commissioning. There were concerns about admission and discharge, monitoring lengthy stays, inappropriate placement, and people getting stuck in services and families feeling unable to get their relative out. There was also a lack of functional analysis of behaviours, and that had an impact on physical intervention, seclusion, and medication. They were concerned about person-centred approaches. There were things, as we've already heard this morning, like lack of communication, people not being able to communicate with the individuals who were in the services. There were concerns about people losing skills when they were in these services, lack of activities, and also concerns about the quality and the independence of the advocacy that was available. There were very big concerns about restrictive practices. We've already talked this morning about the use of physical interventions. There was also concern about the lack of awareness of deprivation of liberty safeguards, and huge concerns about the use of seclusion, where people were, quote, nursed in their rooms, unquote, which meant that they were kept on their own, away from everyone else, and not interacting with anyone else in the service. There are also concerns about family involvement, and these ranged from access, for example, rigid visiting hours, the location of the service, families were finding it difficult to get to, utilising family contact as rewards or punishments, and lack of information for families that was useful. And there was certainly a feeling that families weren't regarded as partners in their relatives' care and support. Family carers in the inspections also had concerns about the methodology used in the Care Quality Commission inspection processes. So although they found it very positive to engage with experts by experience, they felt very clearly that it needed to go further, that this wasn't just a one-off, it needed to be embedded as practice. And there were also concerns that whilst all of these people were involved in the initial visits, no family carer experts by experience have been involved in any of the follow-up visits where concerns were identified. So family carers who were experts by experience in the CQC process had a range of recommendations that they made. So I encourage you to go to the Care Quality Commission site and read the report. Shortly after the Panorama programme, the National Valuing Families Forum had a meeting with the Minister for Social Care, and the next two slides are part of their presentation. And here you can see the difference between government policy, which says we should have individual and person-centred services, that they should be local, outcome-focused, provide value for money, not be institutional, and community-based and open services, in contrast to Winterbourne View, which was not individualised or person-centred, was out of area. There were no outcomes for the individuals. It was generating profits for private company shareholders. It was clearly institutional. It was on the edge of an industrial estate, and it was a closed service. So going back to my earlier slide about our responsibility to vulnerable people from a safeguarding perspective, clearly placing someone in a service of this sort increases the risk to them. Indeed, Margaret, in her report, identifies hospitals for people with learning disabilities as high-risk environments. Families considered why we have Winterbourne View type services and came up with a number of reasons. Local person-centred support and services are not developed. There's a lack of long-term planning and strategic commissioning, including housing. Places are purchased ad hoc in crisis. The Care Quality Commission register these sorts of services, which gives them credibility and legitimacy. Once people go in, it's hard for them to move on. There's a lack of proper reviews and monitoring outcomes. People with learning disabilities and family carers are disempowered, safeguarding's not working, and the incentive for private providers is profit. So how do we move away from Winterbourne views? We need to change direction, and we need to have alternatives to institutional care. We know what doesn't work. We know what does work. We know what we're aiming for, but we need to change the pathway. In order to do that, we need to deliver alternatives. We need leadership at all levels, from national government, local government, from commissioners, from service providers, from people with learning disabilities and their families. We need change management. It won't just happen. We need to be leading that change, and we need to manage that change. We need commitment from all stakeholders. We need partnership from a range of stakeholders working together, and we need to plan both for the short term and the long term. So what needs to change? We need to work together to focus on and invest in prevention and local support and service development. We need to think about commissioning. It is not just purchasing what's available. We need registration and monitoring that's fit for purpose. We need effective safeguarding. We need to collect data that's useful, and we need clearer lines of accountability. And all of us have a collective responsibility to do that. All of us have a role to play. We can all of us make a difference. So thinking about making a start locally, and someone's already said this, it's about knowing what to do and where to start. So we need to be thinking about planning and delivering, and planning needs to be based on good information about local people. My son had to go to an out-of-area school because there was no local service that could meet his needs. Once he was out of area, there was no planning for him to return, even though that we know that children who have severe learning disabilities and behaviour described as challenging are very likely to grow into adults who have severe learning disabilities and behaviour that's difficult to manage. So there's no excuse for not planning. We need knowledge and expertise about supporting people whose behaviour challenges, and there is a huge amount of information available. We need knowledge and expertise about service development in partnership, because it's about people working together to develop the right local support around the person. We need to understand progression and maintenance. Services should not be standstill services. But equally, if support is working, it doesn't mean it's not needed. And finally, we can do this. We have done it for some people. We need to do it for everyone. Challenging Behaviour Foundation, as well as working to support families, to empower them for their individuals, we need to think about working nationally and strategically. So we bring together a range of stakeholders into the National Strategy Group, which is key stakeholders working together in a coherent, collaborative way to an agreed charter. So the charter provides an agreed framework to which we're all working. It identifies key stakeholders and key areas of intervention across children and adults. And then under each charter point, we've developed action plans. And in Surrey, I know that that charter is being used as an audit tool for services.